Good morning and welcome to The Point. It is Wednesday, September 22nd, 2021. Thank you to those of you joining us on the GBN Grenada Broadcasting Network's Facebook page, the Grenada Broadcasting Network's YouTube channel, the website www.gbn.gd, GBN TV channel 7, 11 and 20. Good morning to the listeners of Classic 105.5, 105.9 and the viewers on Party Grenada and Go to Fet Facebook pages. Always a pleasure to have you. Joining me virtually this morning once again is Minister of Health, the Honorable Nickolas Steele, and Senior Medical Officer Dr. Myanna. Charles. Thank you very much for joining us, ladies and gentlemen. I'm happy to have you to get the latest update on, of course, COVID-19 and maybe other health issues. Thank you once again.
Good morning, Blossom, and good morning to all of your viewers and listeners out there.
Happy to have you. Where should I start? No, before we get into COVID, let me get something out of the way or on the table. So Minister Steele, this morning I hosted members of the Rastafarian community and they expressed that they feel marginalized, they feel left out of national discussions, especially when it comes to, or including when it comes to COVID-19 and the COVID-19 vaccine and so. And it really spurred from the news conference that was held the other day with religious leaders that they said they were not invited to and discussions have not been held with them. Can you share maybe why they've been left out and any intentions to reach out to them as well?
Well, first off, they have been reached out to, and no, there was no intention. It was not intentional. We reached out through Ministry of Ecumenical Services to the various organizations. And unfortunately, the Rastafarian organization is not part of any of those entities. So when we reached out to get as many people to table as possible, there was not an effort to reach out individually to the Rastafarian or the Jewish community. Both were not reached out to, simply because they were not part of the two umbrella entities that we are accustomed dealing with. COVID-19 brings many things to light that need to be fixed in our society. One of them is greater engagement with our Rastafarian community. And I look forward to them initiating, as well as they have, to make sure that they are involved in any and all processes where an individual's religion needs to be taken into consideration.
They've also given me permission to share their contact information, so I'll do that at the end of the program, so at least we can...
By all means, we just make sure that it's the same contact that we're dealing with, and if not, that we can deal with others, because as far as I'm aware, there are at least one or two different groups within our Rastafarian community here in Grenada as well.
Correct is right. All right. So now that that's out of the way, now let's get into the specifics on COVID-19. The natives dashboard, what stood out to me really, while I'm happy to see that the numbers are less than what we've seen in past days, specifically 300 and something over the weekend, what stood out to me was that we recorded 12 deaths in the space of 24 hours. So you can just give us a breakdown, a reminder of what the latest dashboard looks like and what it means for our evolving and unfolding epidemiological situation.
Dr. Charles?
Good morning, Blossom.
Morning, Dr. Charles.
And thank you. And I'd like to say good morning to all the listeners and the viewers. Now, I'll just give a brief update of our latest numbers and as it relates to COVID-19. So to date, we have recorded 4,356 cases, confirmed cases, that is, of COVID-19, of which 2,021 have recovered, right? And we still have 2,260 who are still active. Now, in terms of a further breakdown of the active cases, most are females at 53%, and the age range of active cases are from 2 months to 103 years old. And important to note, of the active cases, 85% are not vaccinated. All right. Now, as you mentioned, Grenada has recorded 75 cumulative deaths of COVID-19 and 12 in the last 24 hours. This is indeed an alarming number, but of the deaths we recorded in the past 24 hours, some occurred in the community, so persons who would have died at home, and some occurred in the hospital. And most of the deaths, again, are in persons who are not vaccinated. And it's really a reminder for persons as well. And I want to stress this, that anybody who is at home and are experiencing the warning signs of severe illness, please seek medical attention immediately. Because we have seen this. Persons are staying home until things are really, really dire, right? And some persons are not even seeking medical attention. So I want to reiterate that. And some of the warning signs you need to look for: persistent pain or pressure in your chest, difficulties breathing, new onset confusion, so persons not knowing where they are, they cannot recognize their family members, those sort of things. If you notice a change, or one of your family members notice a change in the color of your lips, your nail bed, and so forth, right? Or let's say if your condition starts worsening, right? If you start to feel worse, please seek medical attention. Do not stay at home, because all of these are indications of severe illness. All right. I just want to reiterate that. Now, moving forward, I would like to express my deepest sympathy to the family and friends of the deceased during this difficult time. I know it is indeed quite a difficult time for a lot of persons, and a lot of persons are mourning their loved ones. And to date, I think each and every one of us, have known somebody who would have been hospitalized because of COVID-19, or somebody who would have died due to this deadly disease. I have been impacted in that way, right? So I really do want to empathize with the persons, and the Ministry of Health, we are with you. Those persons, we have support and counseling available for persons experiencing losses right now. Right? So again, our hearts go out to you, and we are with you through this difficult period. In terms of the further numbers, I just want to elaborate the vaccination and also the vaccination statistics on the deaths. Now, what we've seen is that 97% of the deceased were not vaccinated. Again, Grenada started to roll out COVID-19 vaccines since February 15th, right? And I want to continue to encourage persons to go out there and get vaccinated, because vaccination, right? And we need to remember this. I've heard comments, when I was on the ground in the pop-up sites and the pop-up clinics, why should I take the vaccine if I could still get COVID-19? Now, at the end of the day, right, the vaccine reduces you from becoming severely ill, which means the vaccine will reduce you from becoming hospitalized. It also significantly reduces death, and this is evident in our population. All right, it is quite evident. The vaccine will reduce the chances of you transmitting the virus to others. So there is indeed a lot of benefits to vaccination. What reduces exposure is the preventative measures we've been preaching. Wearing your mask properly, sanitizing, social distancing, avoiding crowded spaces. These things would reduce exposure. So I want to encourage persons to go out there and get vaccinated, because vaccination works, and vaccination is what will get us out of this. Vaccination is what reduces mortality from COVID-19, right? And this is not only in Grenada, this is throughout the region and internationally. If you look at the global numbers we post as well, you would see a reduction in the number of deaths, and it's quite significant. And this was only possible through vaccination efforts. So again, I want to use this moment and this platform to encourage persons to get vaccinated. All right? Now, as it stands to date, right, of our eligible population, so those persons in our population that is 12 and over who are eligible for vaccination, only 23% is fully vaccinated. So we still have a very far way to go as it relates to vaccination. All right. So again, my encouragement for persons this morning is to go out there and get vaccinated, because vaccination is what will get us through this. Thank you.
Do you by chance, with the deaths, those in hospital, the people who are hospitalized, do you by chance have a figure as to how many are in critical condition?
I do not have that figure with me at present.
No problem. In relation to the dashboard, I saw maybe twice, 3 times that in addition to the new cases announced, there was also a section for the amount of tests conducted. Why only remove it? I was using it to, see what really going on with the testing and so on. Any intentions to put it back?
Absolutely. And one of the things over the weekend, as you would imagine, we conduct quite a number of tests, over 3,000, right? The more tests you do, the more cases you will pick up. All right. So again, we wanted to give persons an idea of the number of tests we're doing, because we don't want person to think, we're recording a lot more cases. We're recording more cases because we're doing more extensive testing. All right. But absolutely, there are discussions now to make some additions to the dashboard. And yes, we have intention to continue with this.
Okay. In hindsight, looking at the way that members of the public have reacted to the pop-up testing and vaccination sites, in hindsight, do you think that should have been done earlier, taking the tests and the vaccines to those communities instead of asking people to come to get tested at the stadium and the centers?
What I would say, right? I mean, looking back, right? Now, we did have stationary sites, right, for vaccination. But we were also doing those sites in the communities as well. I remember going to St. Mark's, where I'm from, to vaccinate persons myself. So, those were there from the beginning. The question is, should we have had more pop-up sites or more pop-up vaccination centers in the beginning? Then possibly, yes, in hindsight. But, it was there. And the thought process was always to make vaccination accessible, to members of the community. Persons who simply do not have the means to come to one of the stationary sites to get vaccinated. So we did make it available in the communities. The question is, should we have had more sites in hindsight? Then yes, that is a possibility.
Okay. I have a concern with self-medication. There are people who are self-medicating, whether they've been tested positive or experiencing symptoms and treating themselves, as well as the continued promotion of the use of ivermectin. Just yesterday, I spoke with an individual, and he told me he got what's what I'm looking for? A prescription for ivermectin, to use ivermectin, and he doesn't have any horses. So I'm concerned deeply about that, including or especially the use of ivermectin. How are we dealing or tackling that aspect of this pandemic?
Right. Now, what I would say to this, now, the Ministry of Health and our stance has always been to promote evidence-based interventions. We would not solicit or promote any intervention for treating COVID-19 that has not been approved. And ivermectin, sadly, is one of those. Now, as it relates to persons who are sick in the home, time and time again, we give some tips. So I would say to persons, now, continue to hydrate, drinks a lot of fluids, right? You can increase your vitamin C uptake through fruits or through vitamin C tablets. What we encourage persons to take if they're having pain, fever, body aches, you can use Panadol as instructed by your physician. Additionally, persons can use zinc, right? And that is something we have said time and time again. If you're having a cough, you can use certain cough syrups. But as it relates to those medications, we have to remember, ivermectin is intended and has been approved for other things, to treat other infections. And it has not been approved for treatment of COVID-19, right? COVID-19 is a virus, right? Originally, ivermectin has been used traditionally to treat parasites, right? And it has not been approved for COVID-19. And these medications have a lot of side effects. So persons, the Ministry of Health does not solicit the use of ivermectin, and persons who are taking this medication, I like to discourage them from that. And they're doing so, sadly, at their own risk, because the medication in itself has side effects.
Let me add to that, Blossom. This is not a rash, a skin rash or so that we're dealing with that people can use their own prescriptions or etc. This is a deadly disease. People are dying. And our concern is that in persons self-medicating with prescriptions, that the only way that somebody can get a prescription for instance, ivermectin, is if they're saying that they're not using it on themselves, but they're actually using it for the veterinary purposes, that they have a cow or horse or goat or so that they're going to be using it on. So it means that they may be getting the wrong dosage. It means that they may be getting the veterinary prescription or the veterinary version of the ivermectin as well. All of these things can complicate the situation. It means that by the time they get to the hospital, the doctors may not know what they have been prescribing for themselves, and may have different reactions or so to the medication that they're trying to give them. So it really does complicate, and it puts individuals in a dangerous position.
All right. The next question that came up in my mind relates to vaccine and comorbidities. We know that according to the research and the data, when you have comorbidities, high blood pressure, diabetes, if you contracted COVID-19, it can exacerbate your illness, and that can be fatal for you. But something that occurred to me over the weekend: what if you have comorbidities, uncontrolled comorbidities, and you get vaccinated? Can that affect how your body reacts to the vaccine? So let's say I have high blood pressure or I'm diabetic and it's not controlled. If I get the vaccine, would that mean I may experience worse symptoms than if it was controlled? You understand what I'm asking?
I understand. Yes, I understand the question. And first I will start by, reiterating that persons who have comorbidities, or what we call underlying medical conditions, and you mentioned some, like high blood pressure, diabetes, kidney disease, cancer, the elderly, they are at increased risk of getting severely ill, being hospitalized, or even dying if they do become infected with COVID-19. And in these persons, we strongly encourage and recommend vaccination. And if I take you back a bit, when we did our vaccine rollout, we put it out with frontline workers. Our next group was the elderly and persons with underlying medical conditions. In a lot of countries, this was the first group of people in the beginning that the initial rollout of vaccines targeted, because the evidence shows that they're at risk of severe illness, if they become infected with COVID-19. Now, I want to encourage persons with chronic conditions, like I've mentioned before, this is a time more than ever. We have to continue taking the medication for the chronic illnesses. Your blood pressure, for instance, continue taking your blood pressure tablets. You don't want your blood pressure to go out of control. Continue taking your insulin or your tablets for your diabetes, because that in itself has other complications, and can put you at risk for other things. So I want to encourage persons to continue, taking the medication for their chronic illnesses during this period. Now, to the specific question you asked, now, if the persons with those underlying conditions, and for instance, let's say they have high blood pressure and their blood pressure is uncontrolled, or they're diabetic and their sugar is uncontrolled, if they get a vaccine, does that worsen the underlying medical condition? So the simple and short answer to that question is no, it does not worsen the underlying medical condition.
No, not necessarily the underlying condition. Worsen the effect of the vaccine. Like,
yes,
some who may experience fever normally, would I have a higher fever if my diabetes is uncontrolled?
No, you would not have a higher fever. But again, it is more complicated than that, because if you have uncontrolled diabetes, you're at risk for getting other things. You're at risk of getting infections. And this is something that happens normally, without COVID being present. All right. So, I just want to encourage persons to ensure that the medical conditions remains under control. So it would not worsen the side effects of the vaccine, or it would not cause any changes in the immune response or the protection generated by the vaccine.
Okay. There was another question. The vaccine, Pfizer-BioNTech. When we initially got our supply of Pfizer, I believe the expiration date was a month after we got it, or something like that. Just remind me of exactly what it is. I think it was a month after we got it, the expiration date.
So the expiration date is at the end of November.
Oh, okay. All right. Okay. There's also a study of what country? Is it a country? I believe it's a country. Administering the Pfizer vaccine, or they found that it's safe to administer Pfizer vaccine to children as young as 5 years old. Is this something that we are considering here in Grenada?
Right. Now, again, we would wait to get approval and wait for it to be approved in that age group before we make such a decision.
Okay.
So at this stage, no.
Okay. All right. What was the next thing? Right. So the other thing that raised concern for me, the ministry has been sending out some information on its social media, and one of the flyers on social media spoke about if you've been affected or infected with COVID-19, after 2 weeks, you do not necessarily have to wait to be retested. You are deemed clear and you can go about life as normal with the protocols in place. That's concerning to me. How are we so sure that they will be recovered in 2 weeks without a test or 2 tests?
No, the Ministry of Health, now our guidance, I'll tell you this, the World Health Organization recommendation, right? When a person becomes infected with COVID-19, if that person have no symptoms at all, the isolation period that is recommended is 10 days, right? If that person has symptoms, the isolation period recommended is 10 plus 3 days, right? And the reason for that, and the science show that after that period, right, persons are deemed as no longer infectious, meaning they're not able to pass on the virus. We have to remember that persons can shed the virus for up to 90 days after becoming infected. But shedding does not mean that they're infectious. So that period, that 14-day isolation
infectious
period,
meaning able to pass it on.
Pass it on to other persons.
Okay.
Right? So persons can still shed a virus for 90 days, right, after they were infected with COVID-19. But while you're shedding, you're not able to pass on that virus to other persons, right? You're not deemed as infectious. So that period, that 14-day period, right, evidence show that after that period, right, most persons would have cleared the infection and are no longer infectious, being able to pass it on to other persons.
Okay. All right. And have we had any instances of, how do they call it, long COVID, long-term COVID?
Yes, long COVID.
Is it a regular, frequent, popular experience in Grenada, or are most people recovering or recovered after the 14 days?
Based on the reports we've had so far, I haven't received any reports of persons with symptoms suggested of long COVID, but that is something that do happen. Persons up to 1 year after being infected with COVID, they still continue to report symptoms like difficulties breathing, memory fog, and other issues. But I have not heard of any as yet in Grenada.
Okay. Let's take a break, and then we're going to come back and continue the discussion with Minister Steele and Dr. Charles. We are speaking with officials of the Ministry of Health, getting the latest on COVID-19. To the point, we'll be right back. I see questions popping up, so let's take a quick break and come back and get straight to them. This is To The Point on GBN and Classic.
This is a message from the Ministry of Health. If you or a family member suspect that you may have contracted COVID-19 and are displaying symptoms, please immediately self-isolate at home. This means that you must also avoid all contact with other members of your household. Do not visit hospitals or health centers, as this creates the potential for further spread of the virus, and it puts additional persons at risk when you come into contact with them. Your best course of action is to call the COVID-19 hotline at 458-4787 or 538-4787, or contact your nearest health center or medical station. Once your information has been received, health officials will come to you. How prevent the spread of COVID-19? This has been a message from the Ministry of Health.
Looking for that injection of vibes and energy, of course? Well, I've got just that. Hi, my name is Gary, Mr. Smooth, and I'm inviting you to join me on the Hot Morning Show on Hot 98.5, 98.7 FM. Weekdays, Monday to Friday, 6 to 10 in the morning. I've got a healthy dose of your favorite and most infectious hits sampled with information, news, laughter, and all the other ingredients that go into making the hottest morning show on the radio. The Morning Heat. And while you're at it, don't forget to hit us up on WhatsApp, 435-7517. We've got topics, we've got discussions, calls, voice notes, and so much more. But I can't tell you everything. You gotta tune in. The Hot Morning Show on Hot FM 98.5, 98.7 with yours truly, Gary, Mr. Smooth. Kaboom!
There's no better way to start your day than with me on Good Morning Grenada. Covering everything you need to start your mornings off right. 6:35 a.m. on weekdays on all GBN platforms. Good Morning Grenada, adding a little blossom to your mornings.
Feel good facts.
Help prevent cold and flu by washing your hands with soap and water for at least 20 seconds. That's the time it takes to remove most germs. No soap and water? No worries when you've got alcohol-based hand sanitizer.
Welcome back to The Point. We are speaking with Minister of Health Nickolas Steele and Senior Medical Officer Dr. Myanna Charles. We're getting the latest in relation to COVID-19. Before we open the platforms for our viewers and listeners, Minister Steele, today's Wednesday, so on Monday I saw a report of some Mexican nationals coming into Grenada to assist us in this fight with COVID-19. Just give us some updates on their mission here in Grenada, and have they started as yet? Have they completed the quarantine period as yet?
Yes, Blossom, they have. They're on the ground with our medical team, ICU team, and working hand in hand. And we're really appreciative to the government and people of Mexico and these 5 individuals, 3 ICU doctors and 2 nurse practitioners who are here making a difference. And also on Monday, we also had a team come in under the leadership of Dr. Philip Bonaparte, a son of the soil, member of the Grenada diaspora. He and his wife, Tracy, are here with another nurse to assist in the ICU as well, and with COVID support. And Dr. Bonaparte also brought various medical equipment and medicines that he would be using himself. So he came with a full package to use. So we're most grateful to both of them. And on behalf of the medical team, we just want to express our heartfelt thank you to them, to both those teams.
And Dr. Charles, let me ask, earlier you mentioned that there are people who are waiting until the situation gets difficult and worse before they seek medical assistance. And I'm sure there are people who are passing away before they actually seek assistance. Are we seeing a lot of cases like that? People actually dying before they call the hotline or before they could get tested?
Well, what we've seen is, yes, increase in the number of cases of persons dying at their homes due to COVID-19 and even en route to the hospital. Again, I want to reiterate, there are warning signs, meaning there are serious symptoms of COVID-19. And if you're experiencing those symptoms, this is an indication that you need immediate medical care. All right, it's the indication that your oxygen levels, as we know, COVID-19 primarily affects the lungs. All right, so it could be an indication that, the condition of your lungs are worsening, right? And you may need immediate medical care. All right, now, some of those warning signs or those serious symptoms of COVID-19 are difficulties breathing, or what we call shortness of breath, right? Confusion, right? So persons not being able to identify their family members, or they don't know where they are, they don't know what time of the day it is, right? All of these things are indication that your oxygen levels in your blood might be very low. All right? Inability to wake or stay awake. Another indication again that your oxygen levels might be low. Persistent pain or pressure in the chest, right? Other things is pale, gray, or blue-colored skin or lips, right? All of these are indications, right, that your oxygen levels are low, right? And these are indications that you need to seek immediate medical care, because the treatment you require at this stage it cannot be provided at home. All right. So we're encouraging these persons to come in or call before the situation gets worse. All right. Don't stay at home, right? If you're experiencing those sort of symptoms, please seek immediate medical attention.
And that brings up another issue I noticed on social media. Minister, maybe you can come in here as well. I've seen people posting on social media, I'm trying to remember off the top of my head, I think more than 3 people, that they've called for assistance and medical personnel are telling them they're afraid to come to the home because of possible COVID-19 exposure. So they're not attending to some of the people who are calling for help. Have you seen those reports?
Look, Blossom, I can only speak to what the policies of the ministry are and what our directives are. We have to recognize that we have human beings implementing that policy. There is no such directive or policy or expectation that any of our healthcare workers in the community or in the hospital are supposed to tell an individual that they're afraid to give them the medical care. They have the required equipment, PPEs, and training and knowledge to be able to refer them if they're not qualified to do so. But it may have happened. They may have been communicated to by one of our individuals within our system, or someone proposing to represent one of our individuals. But I want to categorically say, and Dr. Charles is saying the same thing, if an individual believes that they need medical attention, they should get in touch with us. If an individual shows any of those signs that she has mentioned, they definitely need to get in touch with us and call for an ambulance, so at least they can get to the hospital on time. We are seeing too many individuals that by the time they do make the decision to call for assistance, it is too late for us to help them. And we don't want that to continue. That is not necessary. That is avoidable. And we really want to work together. If you can help us with that too, Blossom, with respect to all of your programs and your colleagues, and so to let individuals know that there is a hotline, let individuals know what those symptoms are, keep repeating them, and let us get in touch with people before it is too late.
Will do. All right, now let's get to our viewers and listeners who may have comments, questions, queries, concerns. Landline number 435-2041. WhatsApp number, it's also 435-2041. Please, only written messages on WhatsApp, and you can continue to post your comments and questions on Facebook and YouTube. Let me go to the first caller. Good morning, caller.
Good morning to you, Blossom, and to your followers on the various platforms. And good morning to Minister Steele and Dr. Charles. We're up to a very sad morning. It's a very dark day for us, sadly. But there is a light at the end of that tunnel, and I'm not sure that we're seeing the light. Now, correct me if I am wrong, but based on the statistics I'm seeing here, I'm seeing a very bright light. If you're telling me that 22,010 persons are fully vaccinated, they got both shots, and you have, simple statistics, simple arithmetic, you have an additional 32,727 who have had just one shot. It means that we have 54,737 who have had at least one shot. In every other country, in every other jurisdiction, the stats is simple. Grenada is the only one. Now, somebody who has two shots, you're done with them. You cannot include somebody with, we're not talking about vaccines, Minister. See, not in your head. We're talking about people. But it's not that we're mixing up. I make my livelihood looking at figures and studying them. We are mixing up vaccines and people. Forget the vaccines. Forget vaccines. We're talking about people. You say persons. If you have 32,000 persons who have one shot, and you have 22,000 who are fully vaccinated persons, based on what you have said, it means that we have 54,000 persons who have had at least one shot. And to me, that is a light. And if we can get those figures correct and interpret them correctly, it means that we can go back to the people of Grenada and say, hey, this is how close we have gotten to. If only 15,000, 20,000 of you could come out in the next 2 months and we could work at daily rate, we can get to herd immunity.
Okay.
But if we continue to say that we only have 10,000 with one shot, when we've already given out more than 10,000 Pfizer and the AstraZeneca people who've been waiting for the last 8 weeks, and we still have only 10,000 people with one shot. Something has to be wrong with the logic there.
Okay.
And I think because of that, we're missing an important point which can be a motivation and incentive to sell vaccination. That's my point.
Thank you very much.
Yep. Plus, I like the direction the caller is taking, but the caller is not reading the stats correctly. We tried yesterday, I think 2-3 times to explain. And the best way I can describe it again is that to get to 2, in other words, to get to 2 doses, you must first have 1 dose. So the 30,000 that have 1 dose, that's people who have taken their first dose. And then there are a significant amount, 22,000 of these people who have taken their first dose have also gone on to take their second dose. So it is not 22,000 plus 30. It is 30,000 who have taken their first dose, and of those 30,000, 22,000 have gone on to take their second dose. So the only fully vaccinated people are the 22,000, and the difference, 8,000 people, are only first dose or partially vaccinated, the difference between the two. So that is the way. And if you think about it, when we first started this process in February, the people who were coming forward in February, you'd see that figure going, persons who have taken their first dose. And then 6 to 8 weeks later, you begin to see the other figure growing. And that's what we continue to do. You continue to monitor those who have come forward for their first dose. And then you continue to show data of those who have come forward for their second dose. But it's not, put them together, it's not 50,000 people that have taken the vaccine. No, it's 50,000 vaccines that have been disseminated. But to some people are going to get their second and some people are only getting their first.
Oh, okay. All right. I think I interpreted it like the caller did. So thanks for that explanation.
Yes. But I would love that if the caller was right in that interpretation. That's where we want to get to. That is where we want to get to. But we are not there as yet.
Okay. A YouTube question. Somebody on YouTube says, Japan has recalled over 1.2 million doses of Moderna because they actually tested the vaccines they received and found foreign particles such as metallic nanoparticles. Have we tested our vaccines in Grenada?
Let me say this, that what does that mean? Nanoparticles. And we've got it exactly. They've recalled it to fix an issue that they found. We are very comfortable with the vaccines that we are using. It is monitored by the WHO, most definitely. So I do understand that persons who have a certain level of vaccine hesitancy in their own personal research and so on, anything that raises any form of red flag or so, they would use as a reason not to take the vaccine. But what I think that article actually shows is a level of monitoring that continues to exist on vaccines. and not that vaccines have problems. It is at the level of monitoring and transparency that exists in vaccine production, that any country, that any manufacturer, that any entity that finds an issue with any of these vaccines at any point in time will report it, withdraw it, and take it out of the system before it gets to people to be used. So it's not that these were in circulation and over here, or so not even the same vaccine that we're using. But they have found a problem, and they're being totally transparent and saying, look, there's a whole batch that's never going to get to people because we found some nano. Nano is almost on the nuclear level, which they never said whether it's harmful or not, or could cause any harm or not. They just said, listen, we found something, we don't like the fact that it's there, and therefore we're pulling the entire batch. So I think we need to find comfort in the fact that there's that level of scrutiny and observance and transparency on the vaccines, that whatever gets to here for us to use through the WHO Pan American Health System has gone through all of those and more levels of scrutiny.
Facebook, are people tested positive for COVID and asked to isolate being prescribed any medication? And are they being monitored anytime during those 14 days? For example, phone calls every couple of days by the COVID unit.
But Dr. Charles, I'm not sure if you want to address with respect to that, and then I can come in afterwards.
All right. Now, persons who test positive for COVID-19 fall into, I would say, probably about 3 brackets. We have persons testing positive and they have no symptoms. All right, these persons do not require any medication. And what we have to remember about COVID-19, there is no specific medication prescribed to kill the virus or to cure somebody for COVID-19. What is managed in persons with COVID-19 are the symptoms. So if you're having a fever, the fever is managed. If you're having headaches, that is managed. Right? If you're having issues breathing or so your oxygen levels are low, that is managed. Right? If you have an underlying pneumonia, right, which is an infection on your lungs, right, on the backdrop of COVID-19, that is managed. Right? If you're having a cough, that is managed. So COVID-19 is a disease where we manage the symptoms, just like the regular flu. There is no medication for the flu, right? The symptoms is managed. All right, and persons recover with time. So for persons who are experiencing symptoms of COVID-19, right, we encourage them, right, especially persons experiencing mild symptoms or so, we do home management and home monitoring. So we encourage these persons to hydrate, right? If you're having a headache, body aches or so forth, or a fever, take Panadol as prescribed. We also encourage these persons, they can take vitamins, right? Vitamin C or zinc, and continue to eat healthy and just take care of themselves, right? So this is the encouragement. And for persons experiencing severe symptoms, right, we refer them for admission and assessment by a medical professional. All right. So again, right, so this is how we deal with persons with COVID-19. As it relates to monitoring of cases in the community, I know Minister would add to that. Now, well, you can.
Yeah. I think Dr. Charles and I agree, and we've been trying to get this message out, which is that we have been saying for months. In fact, we've been saying for 15 months, over a year, that we need to avoid, we need to follow the protocols. We don't want this disease to run amok in our system because it will inundate our health system in the same way that it has done so for every single health system in the world. There's not a single health system that has been able to stand up to COVID-19. They've all, once community spread comes in and their population gets infected, they've all been inundated. And we've been begging and pleading and saying Grenada is going to be no different. So what we want to say, we're not shirking our responsibilities. We're not ignoring the fact that traditionally we are supposed to get in touch with everybody. We are supposed to have the capabilities to get in touch with everybody, give them the results, check in on them, personally, house visits, whatever. Those are our desires and our intent. But the reality is, when you look at the number of cases that exist right now, just right now, the ability of any health system, including this health system, to truly say that you are still expecting a nurse or a doctor to touch base with you every 2-3 days or so to check up. It is our desire. It most definitely is something that is affecting our health team significantly. The inability to reach out to everyone who needs the care. But this is what we've been saying is going to happen and is happening right now. This is what we've been pleading and begging not to have this happen. This is the worst case downside that we have consistently said, if it happens, we are not going to be able to deal with everybody as everybody expects us to deal with them. And we just need to come to terms with that reality and know that the health team like Dr. Myanna Charles, Dr. Sean Charles, Dr. Donnell in the hospital and her team, Dr. Dolan Noel, and our community health nurses who have been there from day one as well, are trying as best as possible, are working 7 days a week. But we just can't deal with these kind of numbers. Nobody can.
Let me go back to the landline. Good morning, caller.
Good morning, Blossom, and good morning to the Minister and Dr. Donald. Now, I must say, listening to the Minister, I get a sense that we have serious difficulties as it relates to COVID. Quite understood. That's a global picture. However, I just want to give, I have one question and just 2 brief comments, but I just want to give a preamble. Now, I have been calling for a test for a long period of time. I don't know if this was communicated, that maybe that has ceased and people will have to go in to the various points to conduct the test. But I have not received that test. I have exhibited symptoms. I was in contact with someone who was tested positive. I collected a check. I didn't stay 15 minutes discussing anything with them, but I just collected the check. And the fact that they had the check, they prepared it, and they were tested positive after I exhibited symptoms. Kids and children were involved, and no one came, right? So no one called. I had to call on 3 occasions. The 3rd occasion, I was told basically, listen, people short-staffed, right? We're short-staffed. So we have to understand. So I understood that, and I didn't travel to create any additional problems. But listening to the minister raise these concerns, my question is this. What level of review, if possible, is taking place with the present health system or present COVID response? Are we looking at ways to improve? Are we critiquing weak areas, gray areas? Are we doing anything like that? And my 2 comments. One, I believe, Minister, that what was required as it relates to the vaccines was to hire a professional communications firm to ensure that the quality of information that would be going out to the public was suitable and able to counter propaganda, was suitable and able to speak directly to specific groups. You're talking people with underlying conditions, youth, women, whatever, and to tackle the thing in a professional way. How it was done, there was an issue of credibility from day one. The whole origin of COVID has an issue. So that, in my view, was a shortcoming. The second comment I want to make has to do with the situation with our health system to really respond to the COVID situation. In my view, if we were able to get resources outside, internationally, and whatever muster, whatever we had here, I would have tried to separate the general health sector and establish some sort of specific COVID response structure that deals primarily with pandemics, that would incorporate the private doctors, that would incorporate a wider array of people to fight this, and not bog down the minister, the CMO, and other public officials who may have other jobs to do, as we know, other than COVID-19. I would have tried to do something like that. Thanks.
Okay, thank you very much. Caller, Minister?
Yeah, Blossom, with respect to professional PR, we have and we continue to. There's been a concerted effort, initiative both locally, regionally, and internationally, to discredit health officials. And I pointed to that yesterday in our post-cabinet briefing, that we still have certain media houses, so to speak, if you want to call them that, not you, Blossom, and not your media house.
I appreciate that
have only been, and history will show, their communication to the public is recorded because they put it out there. There's not been a single positive message. There's not been anything from them to encourage Grenadians to be vaccinated or to stay safe. There's just simply been scandal trying to discredit the health team and the government. I really don't care what they think about the government. As a parliamentarian, I know not everybody is going to support us when it comes to an election or a vote for who would be the next government. But we're in a pandemic right now. And the fact that we recognize this to have been an imminent pandemic, the world that is, since last year, and took such drastic measures as closing borders and confining people, not just in Grenada, Europe, US, all over, Canada, all over, is because there's a general recognition by every single government and every single public health authority that this disease will inundate and collapse any health system and every health system, regardless of your PR, regardless of your credibility, and regardless of the resources. And it is happening all at the same time. So it is not practical, nor has it been possible for us to just simply reach out to bigger brothers or so further up north or first world nations and say, listen, we are a weaker, more susceptible health system, and therefore please help bolster us, because they themselves are struggling and trying to bolster their own health system. And that has been for the last 15 months to almost 2 years now we've been at this. And as such, we have been left to fend for ourselves on certain issues, and we have done. As a region, as a country, we have performed above and beyond, our team, above and beyond. But it did not make us immune as a nation to the effects. And we are now going through our storm. And we have, as best as possible, all the resources that we could have mustered and systems that we could have put in place. But like all others, regardless of their resources and systems, it's not enough. The volunteers, yes, I agree with the caller, the volunteers are most definitely needed. We are getting many individuals from the public, non-health practitioners coming forward and volunteering. But the caller raises a good point as to the ability and willingness of our private practitioners to participate, and the Chief Medical Officer and Senior Medical Officer, Dr. Myanna Charles, can address that, because they have been in direct contact with these entities, asking for further participation from them, following what I assume is the Hippocratic Oath of why individuals are involved in this profession. But no, we are not getting the amount of volunteers, and those volunteers are coming. If they do come, we're getting one or two that are just giving us their everything. But most of them are coming with conditions that just make it very difficult to even interact with them. So we do need some more assistance. They're local. These are local doctors, trained Grenadians like us, with a medical degree that need to come forward and give a little bit more. But I take the caller's points raised, but which we have done. But in doing that, I want the caller to be very much aware, and those who are of that same belief as well, which is a positive belief, that there is no amount of PR and there is no amount of planning, and there's no amount of resources that would have prepared us for and allowed us to get through what we've been through in the last 4 weeks without the challenges and so that we're experiencing.
There's a Facebook. A few of our community health centers are left without nurses in some cases. What are the plans to address this?
But our nurses, those that are out for two reasons. One, we've been, I would refer to it as attacked by various other first world nations, and they have farmed and taken some of our best trained nurses. For years, this has been happening. So we entered this with a shortage of nurses. And in the same way, they chose to come and get our nurses rather than train their own, because there are so many challenges and costs involved in training your own. We were left to training our own, and we have been doing so as best as possible in conjunction with TAMCC and SGU. But also vaccine hesitancy. We have to recognize vaccine hesitancy hit every sector in our community, including our health sector. And many of our nurses, the mere fact that they live in the very communities that have been hit, were or did fall victim to the community spread, and were out the first couple of weeks, and some of them are still out now, and we look forward to them coming back by the grace of God, that they recover, that they come back. And we have some of our doctors too that were, and they're back. Most of them are back because most of them were vaccinated as well, so they're back faster. But this is not a time for pointing fingers, or so we just welcome each and every one of them back, hope and pray that they do recover as quickly as possible so that they can come back to society and come back to performing the roles that they have chosen as career roles in this time where we need them the most. And I'm asking the public to understand that in the same way the banks have had to close, in the same way that most other places all over Grenada have had to close or reduce their staffing activities because their very employees have fallen victim to the community spread, so too in the health system and the police force.
For time for us to end, Minister, but another question in relation to our test kits. I have noticed that, not noticed, but I've heard reports that at some of the sites, the pop-up sites, they are not conducting tests. And I've heard, by the way, that is because we have a lack of testing kits. Is that the case? Even just as recent as yesterday, somebody went to get tested, but he could only get vaccinated because there were no testing being done at the site. So do we have a shortage of testing kits? Shortage, that's what I was looking for.
Blossom, we've been consistently receiving on a regular basis test kits. Logistics, as always, is a challenge in terms of making sure that they get out to the various communities in a timely manner, because the communities are using at a much faster rate than normal. So that has occurred in some instances. But also there are certain sites that are on certain days or fully purely vaccination sites, and there's certain sites that are both, and there's certain sites that are only testing. And we've tried as best as possible to communicate that. But in some instances where a site may be declared by us and chosen to be vaccination and testing, like one of our health centers or so, and then the nurse who's supposed to be doing the testing is sick or has to deal with an emergency or so under these circumstances and does not come that day to do the vaccines, then it means that site suddenly on that day, although the ministry has told people, yes, vaccine and testing, suddenly that site is not doing testing. So we've had those challenges. And those challenges show up day by day, and we adjust as best as possible. We have a great team in terms of our community health team that is focused, that is adjusting, that is dealing with these challenges on a day-by-day basis as this disease evolves. And they're doing a really good job. They need to be congratulated, but we all need to understand that under these circumstances, there are going to be challenges.
All right. Thank you very much, Minister Steele. Dr. Charles, 30 seconds. Final thoughts.
Dr. Charles, you go first.
All right. Thank you, Blossom. I just want to continue to encourage the general public to practice preventative measures, right? Because again, this is what prevents exposure from the virus. So continue to wear your mask, right? In public, even at homes, if you have anybody in the home who have been exposed to or, are infected with COVID-19, sanitize, avoid crowded spaces, all right? And I just want to give some words of encouragement. We would get through this period, and we all have to be our brother's keeper. Before you do anything, we have to take personal responsibility. We have to think about how our actions will affect our colleagues, persons in our home, the persons, everyone, right? So we really have to think about our actions, because before you step out there and you decide, I'm not going to wear my mask, right? You do not know your status. Think about how that would affect your colleagues and the persons in your household. Before you decide, you're not going to sanitize, or you're going to go and sit down and drink and have fun in a crowd. Think about how those actions affect your community, your households, and your colleagues, right? So let's all be our brother's keeper. And I know that we will get through this. It is, a critical period for us, but we will come out of this. And the only way to come out of this is together and united.
Mr. Steele?
Awesome. I think Dr. Myanna Charles has said it most appropriately. I think you are and our public is seeing that one thing we do have within the Ministry of Health is a very strong team that is able to deal with the situations. What we don't have, like any other country, is inexhaustible resources, and that's why we are where we are. But the point simply is, to get through this is with vaccinations, and it is with everyone doing their part. This is a prime example of what happens if a small group, no matter how small or how big the group is, does not conform with or does not follow the measures that are put in place to keep us all safe. What happens? This is what happens when we don't unite together to keep us all safe. And this will continue to happen if and when we get past this wave, if we don't continue to be united on what is necessary for us to keep us all safe. That is vaccination and following the protocols. If we don't do it, we will continue to have wave after wave after wave, deaths after deaths after deaths, hospitalizations, having these conversations consistently every 2-3 weeks, every 2-3 months, back into are we locking down? What are we locking down? How many people should be on buses? How many people are being tested? How many people are dying? If we don't get to that ultimate figure of vaccinations, this kind of interview and this kind of conversation, Blossom, is going to be our new norm. And it shouldn't be, and it doesn't have to be. We just need to unite and for 2 months, just everybody put their differences behind them, forget about the politics, forget about the distrust, pride, or fears. And let's just focus on getting a nation vaccinated and following the protocols. And then we can go back to pointing out our differences, criticizing each other, showing our distrust of each other. And so that's fine. That's human nature. But we are losing so many of our family members in between just because we won't yield for 2 or 3 months and we just won't accept something that we are seeing all of the examples in the US, the UK, Europe. I mean, it really does bother me, and I'm sure you too, Boston, when you put on the TV and you're seeing all of these football matches, US Open, celebrations, and so going on up there because they have reached their level of vaccination. And they are literally back to normal. Yeah, they might have to wear the mask and so, but they're back partying and celebrating. And we're not going to get there until we do what we have to do as well. So I'm looking forward to us coming together, all those of us who are still holding out, to make every effort today, if possible, to get your vaccinations, to start your process on making the difference. Every single life counts. We don't want to lose any one of you. We are losing too many of you right now. Too many. One was too many. We've gone way past one. We had 75 just for today. We are no longer talking about how many we are lost as the topic of conversation. We are talking about how many in a day as a topic of conversation now. And that is totally unnecessary and was avoidable. And we can still avoid it by getting vaccinated. So, as always, Blossom, let's get vaccinated. And as always, let me recognize the yeoman service is being given to this nation by our frontline team, our community health team, our team at the General Hospital, our RGPF, all of our others who are essential service personnel. And in particular this time, the two new teams that we have that have joined us, the team from Mexico and the team from our diaspora led by Dr. Philip Bonaparte and his wife, Tracy. Thank you.
And thank you, Minister Steele and Dr. Charles. Thank you both so very much for giving us this latest update. Of course, we'll keep in touch as the situation unfolds. Hopefully it gets better going forward. Enjoy the rest of your day.
Thank you.
Take care, stay safe.
You do the
and
same.
Get vaccinated. That's the message. Let everybody get vaccinated. Get
vaccinated. There are sites still at the National Stadium, at your medical stations in your communities, as well as the St. Augustine Medical Station. And there are pop-up sites taking place across various communities. Of course, I share them when I get them. So the next time I get a round of them, I will share it with you. Enjoy the rest of your Wednesday. GT is up next with Mid-Morning Buzz. I've stolen about 10 minutes of his program, but we needed to get the information shared. Have yourselves a safe and enjoyable Wednesday. Observe the protocols. Please, please, please. Have yourselves a good one. I'll be back tomorrow, God willing.